I would say without question, it's the biggest decision I've ever had to make.
President Trump raising the possibility of reopening the country at the end of the month, saying it's his decision and his only to make. But medical experts say the timeline belongs to the virus and the importance of widespread testing. A rapid antibody test is now front and center.
Within a period of a week or so, we're going to have a rather large number of tests that are available.
But there's at least one antibody-based test already available, and some doctors have been using it to test their patients for COVID-19 since the FDA initially issued an emergency use authorization. But the feds stopped allowing doctors to use it earlier this week.
We've had to turn patients away who have been requesting our help, and it was terribly difficult. It was gut-wrenching to tell them no.
New Jersey respiratory specialist Dr. Matthew Varghese has been administering the test on his patients with coronavirus symptoms. Here's how the rapid test works. A droplet of your blood is collected into a cartridge, and in 7 minutes it can tell if you have certain antibodies, which are proteins in the immune system that develop days after someone has been infected. If you have the antibodies, it could make you immune to becoming reinfected. That means you're likely to be protected and can possibly return to your normal life. Dr. Varghese says the rapid test is just as reliable as a nasal swab test and has this message for those in charge.
Please make it available to the front line, urgent care, emergency rooms, people like me, respiratory specialists, primary care physicians. I plead with you to please let this test be CLIA-waived so that we can perform this and take care of people.
On their website, the FDA says they're pulling back on the antibody test for now because there are some out there that are unreliable and inaccurate, and that the antibody test should not be the sole basis to diagnose COVID-19. So to be clear, the nasal swab test, a test for the actual virus itself, whereas this antibody test for that, antibodies. Now, the antibody test has been used in China and in South Korea, and also it is expected to be used in Italy. That country, of course, has been so hard hit by this virus. Well, the Italian government is planning a national rollout of antibody testing. We're live outside Bellevue tonight. I'm Shirley Chan, Pix 11 News.